Waking up at 3 a.m. every night is something many people dismiss as stress, aging, or just a bad sleeping habit. But doctors warn that repeated nighttime waking can sometimes be the body's way of signaling that something deeper is happening inside. The human body follows a highly organized internal clock controlled by hormones, brain activity, blood sugar balance, nervous system signals, and sleep cycles. When a person suddenly wakes at the same time night after night, especially between 2 a.m. and 4 a.m., it often means one of those systems is under strain. What makes this especially common after 50 is that aging changes how the brain regulates sleep, stress hormones, circulation, digestion, and blood sugar during the night. The result is that many older adults begin waking repeatedly without understanding why it keeps happening. Some people wake feeling anxious. Others wake needing to urinate. Some feel completely alert for no reason at all. Doctors explain that these patterns are not always random. In many cases, the body is reacting to internal imbalance long before serious symptoms appear during the daytime. One of the most common reasons people wake around 3 a.m. is stress hormone imbalance. During normal sleep, the body gradually lowers cortisol, the primary stress hormone, allowing deep restorative rest to occur. But chronic stress, anxiety, emotional tension, poor sleep habits, or long-term exhaustion may disrupt this cycle. Doctors explain that when cortisol levels rise too early during the night, the brain partially shifts into alert mode, even while the body still needs rest. This sudden hormonal change may cause a person to wake abruptly with racing thoughts, rapid heartbeat, or a strange sense of alertness. Many people assume their mind is overthinking, but in reality, the nervous system itself may already be overstimulated. After 50, the body becomes more sensitive to stress hormone fluctuations, making nighttime waking increasingly common. Even unresolved emotional stress carried silently during the day may continue affecting the brain during sleep. Some medical experts explain that the body often processes emotional tension at night when distractions disappear, causing stress hormones to rise unexpectedly in the early morning hours. Another major cause doctors discuss is blood sugar instability during sleep. The brain depends heavily on steady glucose supply throughout the night. When blood sugar drops too low, the body may release adrenaline and cortisol to raise glucose levels quickly. This emergency response can suddenly wake a person around 3 a.m., feeling restless, shaky, anxious, hungry, or fully alert. Many adults unknowingly create nighttime blood sugar swings through poor eating patterns, excessive sugar intake, alcohol, or eating heavy processed meals late in the evening. Doctors explain that after 50, insulin sensitivity often becomes weaker, meaning the body struggles more to maintain stable glucose levels overnight. Some people go to bed with blood sugar already unstable, and during the early morning hours, the brain reacts strongly to the imbalance. This is one reason nighttime waking is especially common in people with diabetes, prediabetes, fatty liver disease, or metabolic syndrome. What makes this dangerous is that chronic blood sugar instability also affects inflammation, memory, circulation, and cardiovascular health over time. Repeated nighttime waking may therefore reflect deeper metabolic stress rather than simply light sleep. Another shocking reason people wake at 3 a.m. involves sleep apnea and breathing disruption. Many older adults stop breathing briefly during sleep without realizing it. Doctors explain that obstructive sleep apnea occurs when airway muscles relax excessively, temporarily blocking oxygen flow. The brain senses oxygen dropping and forces the body awake repeatedly throughout the night, often around the same times during lighter sleep cycles. Some people wake gasping, choking, snoring loudly, or feeling panicked. Others have no memory of waking at all but feel exhausted every morning. Sleep apnea becomes increasingly common after 50 due to changes in muscle tone, weight distribution, airway structure, and nervous system regulation. What makes this condition dangerous is that untreated sleep apnea places enormous strain on the heart, brain, blood pressure, and circulation. Doctors warn that chronic nighttime oxygen deprivation increases risk of stroke, heart disease, memory decline, diabetes, and even sudden cardiac events. Many people think waking at 3 a.m. is harmless when it may actually signal disrupted breathing occurring dozens of times each night. Hormonal changes also play a powerful role in nighttime waking, especially after midlife. Doctors explain that melatonin production naturally declines with age. Melatonin is one of the body's key sleep hormones, helping regulate deep sleep cycles and circadian rhythm. As melatonin decreases, sleep becomes lighter and more fragmented. Women after menopause often experience additional hormone fluctuations involving estrogen and progesterone, both of which influence sleep quality and nervous system balance. Men may also experience hormonal shifts affecting sleep depth and nighttime recovery. These changes make the brain more vulnerable to waking during normal transitions between sleep cycles. Around 3 a.m., the body naturally enters lighter phases of sleep, making it easier for stress, discomfort, blood sugar changes, or environmental noise to trigger awakening. Doctors often explain that many older adults are not sleeping poorly because they are weak or unhealthy. The brain itself is undergoing biological changes that affect sleep regulation with age. However, repeated waking should still not be ignored because it may reveal other underlying problems needing attention. Another overlooked cause of waking at 3 a.m. is liver stress and nighttime detoxification overload. Some doctors explain that the liver performs many of its repair and metabolic functions during sleep, particularly in the early morning hours. If the liver is under pressure from alcohol, medications, fatty liver disease, inflammation, or poor diet, the body may struggle to regulate blood sugar and toxin processing overnight. This can contribute to nighttime waking, sweating, restlessness, or feeling overheated around 3 a.m. While the relationship between liver function and sleep remains complex, research increasingly shows that poor metabolic health strongly affects sleep quality. Many people with liver dysfunction experience insomnia, fragmented sleep, and daytime fatigue long before severe liver symptoms appear. Digestive issues also commonly trigger nighttime waking. Doctors explain that eating large meals late at night forces the digestive system to remain highly active during hours when the body should be focused on repair and recovery. Acid reflux becomes especially common during sleep because lying flat allows stomach acid to move upward more easily. Some people wake suddenly with chest discomfort, coughing, throat irritation, or a sour taste without realizing reflux is the cause. Heavy fatty meals, sugar, alcohol, caffeine, and processed foods may worsen this significantly. The stomach and brain communicate constantly through nerves and hormones. When digestion remains stressed overnight, sleep quality often suffers as well. Another important factor doctors discuss is chronic inflammation. Many modern health problems involve ongoing low-grade inflammation affecting blood vessels, nerves, hormones, joints, and the brain itself. Inflammatory chemicals may interfere with deep restorative sleep and increase nighttime nervous system activation. Conditions such as arthritis, obesity, diabetes, autoimmune disorders, and cardiovascular disease all increase inflammatory stress. Some people wake at 3 a.m. not because of conscious anxiety, but because the body itself remains internally activated and unable to fully relax into deep sleep. Pain also becomes more noticeable during nighttime hours when distractions disappear and inflammation accumulates after lying still for long periods. Mental health plays a major role as well. Anxiety and depression frequently disrupt sleep architecture in subtle ways. Doctors explain that depression does not always cause excessive sleeping. In many people, it causes early morning waking, around 3 a.m. or 4 a.m., with inability to fall asleep again. Anxiety keeps the nervous system hyper-alert even during sleep, making the brain more reactive to minor internal changes. Some individuals wake with immediate racing thoughts or feelings of dread, despite having no obvious daytime panic. Chronic loneliness, grief, emotional trauma, and long-term stress all affect nighttime brain activity more than many people realize. The brain processes emotions heavily during sleep, and unresolved emotional strain may repeatedly interrupt rest. One especially important truth doctors emphasize is that poor sleep itself gradually damages the body over time. Chronic waking at 3 a.m. is not only exhausting, it affects memory, blood pressure, immune function, hormone balance, metabolism, mood, and cardiovascular health. During deep sleep, the brain clears waste products, repairs neural connections, stabilizes memory, and regulates inflammation. Interrupted sleep, weakens all of these processes. After 50, recovery from poor sleep becomes slower, making nighttime waking more harmful than it may have been decades earlier. Many people adapt to sleeping poorly for years without realizing how deeply it affects overall health. They assume daytime fatigue, forgetfulness, irritability, or low energy are simply normal aging, when chronic sleep disruption may be contributing heavily. Doctors often explain that the body rarely wakes repeatedly at the exact same time, without a reason. The timing itself may reflect underlying hormonal, neurological, metabolic, respiratory, or emotional patterns. The encouraging news is that many causes of nighttime waking improve significantly once identified properly. Blood sugar stabilization, stress reduction, sleep apnea treatment, improved sleep habits, better evening nutrition, medical evaluation, hydration balance, and treatment of underlying health conditions may all help restore deeper sleep. But the first step is recognizing that waking at 3 a.m. repeatedly is not always random. Sometimes it is the body quietly asking for attention long before more serious symptoms appear during the day. Another important but often ignored factor behind waking up at 3 a.m. is dehydration during the night. Doctors explain that as the body sleeps, it continues to lose small amounts of water through breathing, skin, and normal metabolic processes. If hydration during the day is already low, the body may reach a point at night where fluid levels become insufficient for proper circulation and brain function. This can trigger subtle stress responses in the nervous system, causing a person to wake up feeling restless, dry-mouthed, or slightly uncomfortable without understanding why. After 50, the sensation of thirst naturally weakens, which means many older adults do not drink enough water during the day and unknowingly enter sleep in a mildly dehydrated state. Some medical experts explain that even mild dehydration can increase stress hormone activity and disturb normal sleep cycles. When blood becomes slightly more concentrated due to low fluid levels, circulation efficiency may drop, and the brain may respond by briefly activating wakefulness systems. This is often subtle and not dramatic, but repeated over time, it can contribute to consistent 3 a.m. awakenings. Another hidden cause doctors frequently mention is medication timing and side effects. Many older adults take medications for blood pressure, diabetes, heart conditions, or pain management. Some of these medications can affect sleep quality, either by increasing nighttime urination, altering nervous system activity, or changing blood pressure patterns during the night. Diuretics, for example, increase urine production and may cause repeated waking trips to the bathroom, often around similar times each night. Some antidepressants or beta blockers can also interfere with deep sleep cycles. Doctors often emphasize that it is not always the medication itself that is the problem, but the timing or dosage. In some cases, taking medication too late in the day may disrupt the natural sleep rhythm. Because many people assume medications are always safe in all timing patterns, they do not connect nighttime waking with prescriptions unless a doctor specifically reviews their schedule. Another important contributor is poor evening light exposure and disrupted circadian rhythm. The human brain relies heavily on natural light signals to regulate sleep and wake cycles. When people spend evenings exposed to bright artificial lights, screens, or irregular lighting patterns, the brain can become confused about sleep timing. Doctors explain that excessive blue light exposure from phones, televisions, or tablets in the evening suppresses melatonin production, making it harder to maintain deep sleep through the night. As a result, sleep becomes lighter and more fragmented, increasing the chances of waking during natural transition points like 3 a.m. After 50, circadian rhythm becomes even more sensitive, meaning small disruptions in light exposure can have a larger impact on sleep quality than before. Over time, the brain may begin to shift its internal clock slightly, causing earlier waking or repeated nighttime awakenings. This is why sleep experts often emphasize consistent evening routines and reduce screen exposure before bed. Another overlooked issue is temperature regulation. Doctors explain that the body's core temperature naturally drops during sleep, and disturbances in this process can trigger awakenings. If the bedroom is too warm or too cold, or if bedding does not support proper temperature balance, the brain may activate partial wakefulness to correct discomfort. Many older adults experience changes in temperature sensitivity with age, making them more prone to nighttime discomfort. Sweating, overheating, or feeling chilled can all interrupt deep sleep cycles and contribute to waking around the same time each night. Even subtle temperature shifts during early morning hours can disturb lighter phases of sleep, causing repeated awakenings without a clear cause. Emotional processing is another major factor, often underestimated by many people. During sleep, the brain processes memories, emotions, and stress from the day. Doctors explain that unresolved emotional strain, grief, anxiety, or long-term worry can become more active during nighttime brain activity. Around 3 a.m., when sleep cycles naturally become lighter, emotional processing may become more active, leading to sudden awakenings. Some individuals wake with a sense of unease, sadness, or unexplained anxiety, even when there is no immediate external trigger. This is the brain continuing emotional processing during vulnerable sleep stages. Over time, chronic emotional stress may keep the nervous system in a heightened state of readiness even during sleep, making deep rest difficult to maintain. Another key factor linked to 3 a.m. waking is heart rhythm and blood pressure fluctuations during the night. Doctors explain that blood pressure naturally drops during sleep and rises again toward morning. However, in some individuals, especially older adults with cardiovascular conditions, these fluctuations may become irregular. Sudden drops or spikes in blood pressure during the night can briefly wake the brain as a protective response. Some people may feel palpitations, mild dizziness, or sudden alertness when this occurs. Although not always dangerous, repeated episodes may indicate underlying cardiovascular imbalance that should not be ignored. Poor blood pressure control, sleep apnea, or medication timing may all contribute to this pattern. Another silent but significant factor is alcohol consumption in the evening. While alcohol may initially make a person feel sleepy, doctors warn that it disrupts the natural structure of sleep later in the night. As the body metabolizes alcohol, sleep becomes lighter and more fragmented, often leading to awakenings in the early morning hours. Many people notice they fall asleep quickly after drinking, but wake up around 2 to 4 a.m., unable to return to deep sleep. Alcohol also affects hydration, blood sugar stability, and nervous system balance, all of which can contribute to nighttime waking. After 50, the body processes alcohol more slowly, making its effects on sleep even stronger and longer lasting. Another important point doctors highlight is that gut health and sleep are closely connected. The digestive system communicates constantly with the brain through what is known as the gut-brain axis. When gut bacteria are imbalanced due to poor diet, antibiotics, stress, or aging, it may affect neurotransmitters involved in sleep regulation. Some individuals experience bloating, gas, or discomfort at night that can disturb sleep cycles. Others may have subtle inflammation in the digestive tract that influences overall nervous system activity. Because digestion slows at night, any imbalance in the gut may become more noticeable during sleep, contributing to repeated awakenings. Over time, poor gut health may also influence mood, anxiety levels, and energy regulation, all of which indirectly affect sleep stability. Another overlooked reason for waking at 3 a.m. is lack of physical activity during the day. Doctors explain that the body's sleep quality is strongly influenced by how much movement it receives during waking hours. Regular physical activity helps regulate circadian rhythm, reduce stress hormones, improve circulation, and support deeper sleep cycles. When physical activity is too low, the body may not feel naturally ready for deep sleep, resulting in lighter, more fragmented rest. After 50, many adults become less active due to joint pain, fatigue, or lifestyle changes, which can further weaken sleep quality over time. The brain and body work best when energy is properly balanced between activity and rest. Without sufficient daytime movement, nighttime sleep may become unstable and more prone to interruptions. Another major contributor is chronic pain conditions such as arthritis, back pain, or nerve discomfort. Doctors explain that even mild pain signals can disrupt sleep architecture and cause micro-awakenings throughout the night. Around 3 a.m., when sleep becomes lighter, pain sensations may become more noticeable and trigger full awakening. Many individuals may not even fully register pain while asleep, but still experience sleep disruption caused by it. Over time, this leads to fatigue, irritability, and reduced cognitive function during the day. Pain-related sleep disturbance is particularly common in older adults, and managing it effectively often requires addressing both physical and sleep-related factors together. Finally, doctors emphasize that repeated waking at 3 a.m. should never be ignored when it becomes a pattern. While occasional disturbances are normal, consistent nightly awakenings often indicate an underlying imbalance in the body. It may involve hormones, metabolism, breathing, stress, digestion, medications, or emotional health. The important point is not to panic, but to observe the pattern carefully. The body often communicates early warning signals through sleep long before more obvious symptoms appear during the day. Understanding these signals allows for earlier intervention, better sleep quality, and improved long-term health outcomes. One more important factor doctors often connect with repeated 3 a.m. waking is unstable blood sugar patterns during the night, especially in people who eat irregularly during the day or consume high-sugar dinners. When blood sugar drops too low in the middle of the night, the body may release stress hormones like adrenaline and cortisol to bring glucose levels back up. This emergency response can suddenly wake a person from deep sleep, often with a feeling of alertness, mild anxiety, or even hunger. After 50, insulin sensitivity naturally declines in many individuals, making blood sugar regulation more fragile than before. This means the body may struggle to maintain steady energy levels through the entire night. Doctors explain that even small imbalances in evening meals, such as refined carbohydrates, sugary desserts, or skipping protein, can contribute to nighttime glucose fluctuations. Over time, repeated blood sugar dips during sleep may train the body to wake at similar hours, creating a consistent 3 a.m. pattern that feels random but is actually metabolic in origin. Another subtle but significant cause is late-night brain overactivity. Many older adults watch television, use mobile phones, or think through personal worries right before sleeping. Doctors explain that the brain does not instantly switch from active thinking mode to deep sleep. Instead, it gradually transitions through different stages. If mental stimulation continues too close to bedtime, the brain may remain partially active during the night, making sleep lighter and more fragile. Around 3 a.m., when the body naturally cycles into lighter sleep stages, this residual mental activity may increase the likelihood of waking. Some individuals wake up thinking about problems, plans, or unresolved thoughts, without realizing their brain never fully disengaged from daytime stress. This is why sleep specialists often emphasize mental wind-down time before bed, allowing the nervous system to gradually shift into rest mode rather than abruptly stopping stimulation. Another important but often overlooked factor is magnesium deficiency. Magnesium plays a key role in relaxing muscles, calming the nervous system, and supporting deep sleep cycles. Doctors explain that low magnesium levels may contribute to insomnia, nighttime restlessness, and frequent waking. After 50, magnesium deficiency becomes more common due to dietary changes, reduced absorption, medications, and chronic stress. When magnesium is low, the nervous system may remain slightly overactive, making it harder to stay asleep through the night. Some individuals may experience muscle cramps, twitching, or internal restlessness that disrupts sleep cycles without a clear cause. While not always the sole reason for waking at 3 a.m., magnesium imbalance can significantly increase sleep fragility when combined with other factors like stress or poor diet. Another key contributor is age-related changes in sleep architecture. Doctors explain that sleep naturally becomes lighter and more fragmented as people get older. Deep sleep stages decrease, while lighter sleep stages increase. This means older adults are more easily awakened by small internal or external triggers such as noise, temperature changes, bladder signals, or minor hormonal fluctuations. Around 3 a.m., the body often cycles into lighter sleep phases, making it a common time for spontaneous waking. This is not necessarily a disease, but a natural biological shift in sleep patterns. However, when combined with other stressors like poor health, medications, or lifestyle factors, this natural change becomes more noticeable and disruptive. Another often underestimated cause is nighttime inflammation and immune activity. Doctors explain that the immune system becomes more active during sleep to repair tissues and fight off potential threats. However, when chronic inflammation is already present in the body due to conditions like arthritis, obesity, diabetes, or cardiovascular disease. This repair process may become more intense or irregular. Some individuals may experience discomfort, mild pain, or internal restlessness during the night as inflammatory processes fluctuate. This can subtly disturb deep sleep and lead to repeated awakenings. Over time, chronic inflammation may create a background level of discomfort that makes it difficult to maintain uninterrupted rest. Emotional conditioning and sleep anxiety can also play a powerful role in repeated 3 a.m. waking. Once a person begins waking at the same time multiple nights in a row, the brain may start to anticipate it. Doctors explain that this creates a learned pattern where the mind becomes subconsciously alert at that hour, even without physical triggers. This is known as conditioned arousal. The brain essentially expects to wake, which increases the likelihood of waking again. Over time, this can develop into a cycle where anxiety about sleep itself contributes to further sleep disruption. Many individuals begin to worry about waking up, which paradoxically makes the brain more alert during the night. This emotional loop can reinforce the 3 a.m. pattern, even when the original cause has improved. Another important but less discussed factor is environmental noise sensitivity. Even small sounds such as distant traffic, household appliances, pets, or neighbors can become more disruptive during lighter sleep stages. After 50, sleep becomes more sensitive to environmental disturbances. At around 3 a.m., when sleep is naturally lighter, these minor sounds may be enough to trigger partial or full awakening. Many people are not consciously aware of the sound itself, but still experience disrupted sleep cycles. Over time, repeated micro-awakenings may accumulate and result in full nighttime waking. Doctors often suggest that improving sleep environment quality can significantly reduce these disruptions, especially in older adults. Another factor that plays a role is hormonal imbalance beyond just cortisol and melatonin. In men and women alike, other hormones such as growth hormone, thyroid hormones, and sex hormones influence sleep stability. Thyroid imbalance, for example, may cause restlessness, anxiety, heat sensitivity, or irregular sleep patterns. Menopause-related hormonal shifts in women can lead to night sweats, hot flashes, and sudden awakenings. In men, declining testosterone levels may also affect sleep depth and recovery. Doctors explain that hormonal systems are deeply interconnected, and even small imbalances can influence nighttime brain activity and sleep quality. Because these changes often happen gradually with age, many people do not connect them directly to sleep disruption. Finally, doctors emphasize that chronic dehydration combined with electrolyte imbalance can quietly contribute to nighttime waking. Water balance is closely linked to sodium, potassium, and other electrolytes that regulate nerve and muscle function. When these levels fluctuate during the night, the body may experience subtle discomfort or nervous system activation. This can interrupt sleep without obvious symptoms. Many older adults reduce evening water intake to avoid waking for the bathroom, but this can sometimes lead to mild dehydration overnight, which paradoxically also disturbs sleep quality. The body requires a delicate balance, not too much fluid before bed, but also not too little throughout the day. In the end, repeated waking at 3 a.m. is rarely caused by a single factor. Instead, it is usually the result of multiple small imbalances working together. Hormonal changes, blood sugar instability, stress, sleep environment, age-related sleep shifts, digestion, hydration, and nervous system sensitivity. The body often reflects these internal conditions through sleep long before more serious symptoms appear during the day. Doctors consistently emphasize that understanding these patterns is the first step toward improving sleep quality. Once the underlying causes are identified and corrected, many people experience deeper, more stable rest and fewer nighttime interruptions, leading to better energy, clearer thinking, and improved health overall.